Good morning. Thank you all for joining today's live Aspen Health for All conversation. These conversations are a larger effort housed at the aspenhealthforall.org that is amplifying the important work being done by leaders, innovators all over the world to address the disparities that have been amplified by COVID-19. Our aim is to focus on health equity and connect a range of experts working on the front lines of health around the world as we all pivot to respond to the challenges of COVID-19. We're in search of common solutions and shared insights. And as the US reckons with the legacy of racial injustice and continued systematic oppression of Black lives, we want to take this moment to say that we will not tolerate violence and hatred against Black communities. Our global community stands tall with local leaders, collaborators, healers, and fellows who've long been beacons in this movement and whose voices and work are critical to reshaping a healthy, equitable future for all. Today, the Aspen Global Innovators Group is excited to host a conversation with Joy Pamafi, AMP board member and executive secretary of the African Leaders Malaria Alliance, and Dr. Andrew Silumesii, director of public health at the Ministry of Health in Zambia. We're honored that our own Dr. Robert Newman, director of AMP Health, will moderate today's session. And as a reminder, please feel free to ask questions throughout the session using the Q&A box. With that, let's get started, and over to you, Dr. Newman.
Morning, afternoon to those of you in Africa or elsewhere in the world. Thank you very much for the introduction, and it's an honor to be here today with our very distinguished guests and build on the introductions that Sian gave. So first, the Honorable Joy Pamafi. She is Executive Secretary of the African Leaders Malaria Alliance, a position she's held since 2010. She's also the former Minister of Health of Botswana. She's currently co-chair of the UN Secretary General's Independent Accountability Panel for Women, Children, and Adolescent Health. And I've had the pleasure of collaborating with Joy for the past dozen years as we work to address the intolerable burden of malaria, especially in Africa. So it's really an honor to have you with us today, Joy. And Dr. Andrew Silimazi has been the Director of Public Health in the Zambian Ministry of Health since September 2017. His role involves providing strategic direction, oversight, and coordination of Zambia's public health programs. And in addition to his bachelor's in medical degrees from the University of Zambia, he holds a Master of Science in Public Health from the Institute of Tropical Medicine in Antwerp, Belgium. And I've had the pleasure of working with Andrew over the past couple of years in developing the leadership and management capabilities of the Ministry of Health staff in Zambia. It's really been an honor to work with you, an honor to have you here with us today. So the first question is over to you, Joy. For the last 10 to 15 years, we've seen enormous strides in improving the health of women and children around the world, especially in sub-Saharan Africa. Since the COVID-19 pandemic began, you've been very vocal that focusing on maternal and child health and malaria as a key threat to the health of women and children is more essential than ever. And can you tell us why you think that, and how you would reply to say to those who would say that the focus should be on responding to COVID-19 right now? Over to you.
Thank you so much, Robert. You know, since before COVID-19 hit, we were really not making a lot of progress in achievement of SDG 3 and the universal health coverage agenda. At least 20% lag was estimated by the end of 2019. Yet this was because of inadequacies in investments, but also because of poor governance of health, to the extent that we're losing $2 trillion per year to inefficiencies and corruption. A few areas where there were glaring gaps: 18 million health workers short, health data in most countries incomplete, non-compliance with IHR, accountability, which is essential for good governance, was not embedded in the health system, underinvestment in common goods. Only 1 in 4 births of children was registered. And of the 193 UN member states, only 93 were able to register 80% of adult deaths. Universal health coverage and primary health care was limited to 1/3 and 1/2 of the world's populations. So the progress was really very, very limited. 45% of the global population was using safe sanitation services, whilst 3 billion people lacked such services.
I think we've, Joy, you're frozen to me right now. I'm not sure if frozen to everyone. Joy is currently in Botswana where she resides. And so we
caught in a storm because there was a shutdown of sexual and reproductive health services, stoppage of mass immunization, school closures, children were not feeding, big rises in the deaths of pregnant women. Three months of lockdown led to 15 million more cases of gender violence, even perpetrated against the elderly. And there was a huge impact on newborns, 168,000 newborn deaths, 224,000 maternal deaths. And what we saw was that there was actually a danger, even for areas such as malaria, for there to be a reversal of the gains that we made in the past 10 to 15 years. So this is the situation that COVID-19 has put us in. We are in a storm and we need to mitigate the storm.
Thank you very much, Joy. It's sobering, and I think, it is, we often hear that we've made global progress, and yet I think your introduction is a stark reminder that, the glass half full sounds great, but if you don't happen to be in the part of the glass that's half full, our progress isn't good enough. And that, COVID really threatens the progress that we have made. It threatens that progress and risks us really not reaching the goals that we've all set for ourselves. So very, very, very sobering message, but I think one that we all need to hear and be reminded that COVID really is putting lives at risk, not just through the virus itself, but the damage that it could do to health system progress. So thank you very much for that. Andrew, over to you. Zambia's had its share of public health challenges, high incidences of malaria, HIV, TB, occasional outbreaks of cholera. But on the whole, things have been moving in the right direction. Zambia, like many countries in sub-Saharan Africa, has made significant progress, although as Joyce pointed out, there's plenty of work still to be done. Zambia, really is a much healthier country than it was 5 to 10 years ago. Listening to Joy outline some of these threats, does that ring true for your experience in Zambia? Are essential services being threatened, with the COVID pandemic? And how are you and your team dealing with that threat to essential health services?
Thank you very much, Robert. Indeed, the challenge that COVID poses is a huge one, and Zambia is affected like many other countries around the world, and also specifically in Africa and within the sub-Saharan African region. There's a lot of pressure, a lot of stress that COVID exerts on the health system in Zambia. An example I could give is that of human resource. We historically have had a crisis of human resources for health. And then in a situation where we have to respond to COVID, quite a large proportion of our health staff have to dedicate their services to COVID. And that obviously creates, exacerbates the already existing shortage. So that has been a challenge indeed. But added to that, there have been challenges around the supply chain, availability of essential health commodities, essential medicines, vaccines, and so on. But given the COVID situation, indeed, we have to begin to juggle around the resources, the limited resources that are there, in trying to see how we cope with the situation. So generally speaking, Zambia has indeed paid attention to ensuring that we mount an effective response to the direct threat of COVID. But in our response, one of the pillars that we have kept emphasizing is the fact that we can only consider ourselves to have had mounted an effective response if at the end of the day, our health systems remain intact and we're able to maintain health services, essential health services, continue the provision of essential health services. So the continuation of essential health services remains a key pillar in our response to the COVID-19. And really, this is premised on the lessons that we have learned from observing what happened in the West African Ebola outbreak, where indeed, when analyses are done, we come to discover that the morbidity and mortality resulting from the weakening of the health services really outstrips the morbidity and mortality from the direct threat of Ebola itself. And we don't want to find ourselves in that situation. So Zambia has been paying attention to these issues. For instance, with regards to human resources, we've had to recruit 2,000 extra staff to help us beef up the numbers in the health system. I'll pause there for now. Perhaps I can say more as we proceed.
No, thank you, Andrew. Very well said. And I think that example of the sobering example of what happened in West Africa is entirely germane right now, and really is a cautionary tale for all of us on how things can go astray pretty quickly for essential health services. Joy, pivoting back to you, as people heard during my introduction of you, you're currently serving as the co-chair of the United Nations Every Woman, Every Child's Independent Accountability Panel, which recently released a report entitled Caught in the COVID-19 Storm, Women's, Children's, and Adolescents' Health in the Context of UHC and the SDGs. It's a very, very good and sobering report. And in it, the IAP calls for political leadership, multi-sectoral investments, and whole of government and whole of society approaches to address critical challenges, including collection and use of data, which is where that point was really made. Can you take us through what you think is needed from political leaders now to make sure that we come through this crisis stronger and better able to reach the 2030 targets that we've all signed up to?
Thank you, Robert. I mean, the first thing that we focus on is that we have to sustain existing services, essential services. That is critical. I'll just give you a small example with malaria that we've seen with malaria, where countries and partners have worked together to reprogram existing regional resources to address commodity shortages brought on by lockdowns and supply chain blockages. You have had countries like Namibia, South Africa, Uganda, all countries which are not geographically necessarily next to each other, but supporting one another. We've had the Gambia and Senegal collaborating to address supply chain blockages. And we have had countries that have used technology in data collection and training to maintain training programs, with districts, supportive supervision, oversight, and enable bottleneck resolution. And these are countries like Ghana, Rwanda, Kenya, Zambia. There has been service delivery that has been redesigned so that it can be COVID-19 compliant in countries like Ghana, Kenya, Zambia, again, Benin, Rwanda have done campaigns which are COVID-19 compliant. So this is a way of demonstrating that actually essential services can be maintained. But in addition, we are saying we have identified the lack of accountability as the key driver of failure to deliver on the goals that we've set for ourselves. So when we relook the redesigning, rethinking the health system, we must focus on accountability, a framework that focuses on committing, on justifying, on implementing, and on progress, all these 4 pillars. What we are recommending as the IAP is that first, government should invest in data systems. They must ensure, for example, that births and deaths are registered, and they must monitor the quality and equity of service coverage. Every single country should be IHR compliant. Next, accountability must be institutionalized with a formal relationship between, on the one hand, monitoring, using the data capturing and evaluating and remedy and action that I talked about earlier, reviewing the recommendations and making sure that the remedy and action are actually addressing where the gaps are and that they keep you on track. Finally, accountability must be democratized so that the voices of people and communities shape the programs and the service delivery. Both in ALMA and in the IAP, we are advocating for openness and transparency with fully integrated, institutionalized community scorecards and action tracking mechanisms to ensure that the voices of women, adolescents, older people in the community are heard and acted upon. This accountability is the one that will address that $2 trillion gap per year in inefficiency and poor governance that I spoke about earlier on.
Thank you so much, Joy. A wonderful call out. And I think I'm particularly impressed with the emphasis on community voices. We often think of accountability as somehow a top-down approach, but I think what you and the IAP are calling for, which is a community-driven, all voices heard, is such a powerful message. So thank you very much for that. Andrew, turning back to you, when you think of the future of the public health system in Zambia, what are some ways that COVID has forced you and your team to think differently about the way you are working in Zambia? And how has the pandemic allowed you to reimagine what the health system might look like in the future? Taking this crisis and basically, how can we use it as an opportunity for good?
Thank you, Robert. First of all, I think imagining about our health system in Zambia for the future, I think what really comes to the fore for me is the fact that we need to pay attention to investing in public health security. That as emergency, we see just the devastation that emergency bring to the health system. And we have to be ready all the time with our program continuity plans in place so that in case an emergency arises, we are ready for it. Zambia has taken the initiative of establishing the Zambia National Public Health Institute, which is a specialized organ of the Ministry of Health to specifically look at health security. I think that is an institution that going forward will have to invest in even more and ensure that we strengthen it at all costs. But beyond that, I think the pandemic has also made us realize that we need to focus on resourcing our health system a bit more, really looking at innovative ways of raising resources to invest in the health system. We have gone ahead as an example to establish the National Health Insurance, which has come in handy to supplement the resources that are coming from the Treasury. I think that going forward, we really need to tilt towards increasing domestic financing for health, really trying to move more and more away from donor dependence. I think that will do us a lot of good as we continue to look inwardly. Another thing that I think would be important would be for us as a health system to put on the equity lens. We see from the pandemic that there is a likelihood that those who are more vulnerable in our society will be affected the most. We really need to be looking out for who is left behind the most and how do we address that issue of inequities that may be existent in our society so that those that are left behind the most can really be pulled out of where they are disadvantaged to a place where they become more or less receiving the same services that others are receiving. Maybe finally on this point, it is very clear that we have to harness the use of technology. Very clearly, I mean, it was unimaginable a few months ago just to what extent would be able to use virtual platforms like this one to communicate, have meetings, have trainings and so on. I see this going forward being an aspect that we are going to emphasize even more.
Good. Thank you, Andrew, for a very, very thoughtful and comprehensive answer. I'm going to turn now to questions that have been coming in on our Q&A, quite a few questions coming in. So I'll pick a few, maybe to start with one that links back to something that was an earlier Aspen Health for All session early in the pandemic, but remains a very relevant issue. So one of our attendees is asking Dr. Silumesii, how is Zambia handling the need for PPE? Are you finding enough of it, able to distribute it, or is that reaching all the way down to communities?
Yes, that's an important question. In the response, of course, we've realized that it is important that infection prevention and control are really key, and that's one of our critical pillars. In responding to the pandemic, government did bring together various stakeholders on board and developed a multi-sectoral contingency plan. Of course, that covers a whole range of things, including PPEs. So resources have been mobilized both within from within government, as well as from our cooperating partners to raise resources that are targeted towards procuring PPEs as one of the major requisites in this response.
Great, thank you very much, Andrew. There's another question quite interesting about how we can use community health workers jointly for COVID and for other purposes. The question was specifically around tuberculosis, but I think it's a more generalizable question. And I think community health workers are really a big part of the engine in reaching PHC and UHC goals. Joy, have there been discussions at the IAP and Everyone, Every Child about how we might use the COVID crisis to help strengthen community health worker systems and sort of help accelerate our goals, and whether the Global Fund might actually, part of this question was whether the Global Fund and funds from that could be helped to used for that purpose.
Yeah, absolutely. I think all the global partners, Global Fund, the World Bank, the IMF, are actually addressing both the PPE shortage that we talked about earlier and the need for extra staff, particularly community health work. In fact, in the IAP report, we have used Ethiopia as an example of a community health system that works, that has accountability, and that effectively uses community health workers, both the formal ones and also the informal ones in the community. And this is an absolute a necessity for the rebuilding of the health systems. In fact, when I talked about the 18 million health worker gap earlier on, a big number of that is community health workers who would really revolutionize primary health care and universal health coverage and address the equity issues that the doctor referred to earlier on, because there is exclusion sometimes according to gender, sometimes religion, sometimes ethnic group, sometimes age, and sometimes just because of poverty, the gap between the poverty and the poor, and the quality issues as well. This will be addressed by community health workers.
Great, thank you very much. We have so many great questions coming in, and we're really only going to have time for one more question that I'd like to sort of ask to both of you, so this question I think could apply both globally and in Zambia, and it's a tricky one. What kind of leadership is most needed right now? So what kind of leadership do we need to emerge strongly here? Both, let's start in Zambia. What kind of leadership, Andrew, do you think we really need in Zambia? And Joy, what kind of leadership do we need across Africa and globally to emerge stronger from this crisis? So Andrew, start with you. We only have sort of maybe about 30 seconds each here to answer this. I realize it's a tricky question. Over to you.
Yes, Rob, it's a tricky question, but I think that the kind of leadership that we require is one that leads from the front, saying this is the way we ought to go. Firm leadership, giving direction to the people, and a leadership that is transparent, a leadership that is effective, a leadership that is willing to listen to the people and provide that direction. And of course, a leadership that is transparent and accountable. And I think this is one thing that Joy has been underscoring throughout this discussion.
Thank you, Andrew. And final word, Joy, over back to you. What kind of leadership do we need? You've touched on some of it, but if you can give us a sort of some summary thoughts to emerge inspired to go out there into the world today.
Absolutely. I believe leadership is about accountability, and leadership is about the people. And we need an accountable leadership that can account to the people and that justifies the decisions and actions taken on the basis of evidence and the rights and rule of law, the rights of the people and the rule of law. That is the type of leadership that is required, that is going to enable us to have universal coverage for health services, but also allow the people's goals to be achieved, which are the Sustainable Development Goals. And if we have that type of leadership, the next epidemic will be ready for.
Thank you, Joy. I apologize to those of you that had questions we weren't able to get to. There were lots of great questions coming in. Apologies again that we didn't have time for all of them. A big thank you to Joy and to Andrew for fantastic commentary, fantastic answering of questions. And we traditionally conclude these with a sort of call to action. And I know that that's going to come up here on the slide right now, Sian, I believe. But basically, I don't see that yet on the screen, but I'll start reading that. Basically, we would like to ask all of you to follow Alma at Alma_2030, and also the Independent Accountability Panel at IAPEWEC for the latest on Joy and her team's efforts to support the global health community and leveraging collective voices for action. And also to follow the Ministry of Health of Zambia at MOH Zambia for the latest on what's happening on the ground. And I think it is so important for us all to really pay attention to what's happening on the front lines here of COVID and learn lessons. There are a lot of lessons emerging from countries like Zambia that we can use to take action globally. And finally, we ask you to subscribe to AMP Health's newsletter at amphealth.org/newsletter to stay up to date on how we are working and supporting governments to maintain essential services through improved leadership and management. And we do believe at AMP Health that with visionary leadership and meticulous management, we can help to change the world. So a huge thank you to the participants, to all, to our panelists in this wonderful conversation, and to Sian and the team. Sian, over to you.